cases. In Garissa, 48, Wajir, 4, and Muranga, 8, have all been controlled. We are working closely with the county governments of Marsabit and Turkana and hope that this is fully contained over the next few weeks, at least in the next 2 weeks. We believe that this is feasible, given the fact that the outbreak is currently localized to only 2 areas, which is Marsabit and Turkana. As it relates to COVID-19, we are noticing some interesting trends developing globally that you may wish to be aware of, particularly of those within the medical fraternity. As the virus continues to spread, the infected persons are increasingly exhibiting new, less typical, non-respiratory symptoms, such as sudden strokes in young people, and multi-system inflammatory symptoms, with features similar to those of Kawasaki disease and toxic shock syndrome in children. These cases have largely been confined to the United States, the United Kingdom, France, Italy, and Spain, and have so far not been seen in Kenya. We nonetheless need to be cognizant of them because in each of these cases, tested for antibodies, the results were positive, which indicate that the patients had been exposed to COVID-19. Beyond this, there is a growing number of patients exhibiting non-typical flu-like symptoms, such as gastrointestinal distress syndrome that leads to loss of appetite, nausea, vomiting, diarrhea, chickenpox-like lesions. Over the past 2 weeks, we have increased our testing capacity by more than 40%, and we intend to continue with this escalation. I would therefore like to encourage you, the public, and our medics to be alive to these symptoms. As you may be aware, there are several countries experiencing a reemergence of COVID-19 after they had successfully contained it. Lebanon, Iran, South Korea, Germany, China, and even Ghana, countries that had been hailed as global success stories, are again enforcing restrictions for this reason. I therefore urge Kenyans to keep the social distancing requirements, isolation, and wearing of mask guidelines that the Ministry of Health has issued. This is to ensure that we succeed in containing the disease and not eradicating the gains that we have so far made. Further, patients can indeed suffer infections more than once because the virus can reoccur between 30 and 50 days after the initial recovery. Therefore, people who have recovered are supposed to know that fact so that they can maintain certain elements of healthcare to themselves. It has been found that this happens only in patients with compromised immune systems, which is why we should again be aware of these developments. Fellow Kenyans, friends, yesterday I informed you about our rising numbers. It is worrying that this trend is continuing. Today, we have recorded the highest number yet again at 80, from a sample size of 3,102. This is the largest sample size tested so far. The trend demonstrates that the larger the sample size, the more the positive cases. Today's positive cases brings the total to 1,109, and the cumulative samples to 52,507. And I wish to thank those people, the clinical officers, the ambulance drivers, all those in the Ministry of Health and county health officials who have made the testing of over 3,000 people possible. As you know, we started off with very few, 100 and something. We have been increasing this testing capacity. But I would also like to say that this momentum to continue testing in such numbers is also dependent on us being able to acquire the testing kits and sampling kits that are necessary for us to do so. And as you know, there is still a global challenge. And I want to thank those individuals and organizations who have been able to work so effortlessly to try and get us these new samples that we have. And others who are working very hard in Europe and in the United States to ensure that, that we get them. Again, in Mombasa, Nairobi and Mombasa continue to lead the way in this one, with 41 cases being in Nairobi, while 20 cases are in Mombasa. There are also 7 cases now in Siaya. And the Siaya story is a sad one, because the departure point of that case is actually in Kibera. Somebody in Kibera, without the authority to authorize anybody to travel, signed a document that allowed and was respected by police all the way from Kibera, taking mourners for a funeral in Siaya. The mourners themselves were positive, and therefore were identified by our teams, contact teams in Siaya. So you can imagine, again, there is a reason. There is a reason why we locked down, or rather, caused a cessation of movement from Nairobi. This demonstrates exactly what we are trying to do. So when people think that you are being very clever to escape or to hide and cheat and do all sorts of things so that you can take a body home, you know, it's like biting your nose to spite your face. It makes no sense. So we are asking people, please, Jameni, please, this is something that is going to cause deaths. This morning, we spoke to the Council of Governors. We had a meeting with them today, and we emphasized the issue of Nyumba Kumi and just looking out for anybody who has traveled from elsewhere. The cases across the country are essentially cases that have come from areas that we have advised cessation of movement. We continue to be worried about the fact that some cases are in, we had 13 cases in Kibera. And when we read these figures, I know that there is some who make a lot of funny jokes about these things in Twitter and other places. Actually, the reason for doing so is to let those people in those areas know that there are infections there so that they can guard themselves, so that they are aware that there are cases there. When you are told that there are 13 cases in Kibera today, it is not the same. You cannot behave the same as somebody in Moasabit, where perhaps there is no case of, or somewhere else where in the 20 or so other counties that have got no infections. It is not the same. You are supposed to be aware of what is happening around yourself. So there are 9 cases in Westerns. So persons just near here in Westerns should know that we have discovered another 9 cases. This is not a total. So the person walking around again in Westerns, or Langata at 5, or 6 in Mvita, you know, you should know that your area has got positive cases. And in Kwale, for example, there are 6 cases. Musambweni, there are 5 cases in Musambweni. So when you hear your region having been mentioned, then you should know that you are supposed to be taking care. And that's why we mention them on day-to-day basis. And that's why it's so boring. All right? Because we say the same thing, and it sounds like you are saying what you said yesterday. Well, as a matter of fact, it's news. We are giving you news of the day. And this information is very important so that you can take evasive action against some of these situations. We had 3 Somali nationals in the 80. Well, the balance of those people are essentially Kenyans. The myth that young people cannot get the disease, again, today we reported a 6 months old baby. And this is where, again, there are certain actions, certain protocols that, for example, young mothers and people with babies ought to have. If you are going to if you have a baby in the house, especially a baby as young as that, then you should be very, very careful what you're doing, because you know very well you can bring back the infection to the baby. So if you are the father, if you are the mother, if you are the siblings, then you must take utmost care in terms of the behavior patterns that we are saying. Wearing a mask, keeping your distances, especially in offices and in other places where you visit. If you are a mother, just make sure you go nowhere near anybody. If you are the father, especially young fathers, the same thing. Stay away. Do not encourage any visitors. Let them stay in their houses for a change. They can come back when your baby has grown. But for the time being, wacha wakae huko kwao nyumbani. Anyway, even as our cases continue to rise, we are also glad to inform you that we have discharged 9 patients from hospital, and also glad to say that, again, our fatality number still stands at 50. Therefore, those who have recovered from the disease are 375. But given the numbers that we are releasing, the ones we are discharging, and if you compare that number with the increase in number, I mean, we grew by 80, we discharged 9, therefore 71 cases are now active in our institutions. Again, we continue to monitor our border points just to make sure that we do not have imported cases from the outside. As I conclude, I want to reiterate that this war cannot be fought by the government alone. This war is not one where tanks and bullets and other armory that we have works. This war can only be won by individuals in their houses, individuals in their offices, individuals in the streets, individuals in markets, individuals in densely populated areas who take measures to ensure that they are protected and they are protecting others. So I particularly want to thank those who have followed these rules and therefore saved us the agony of having mass barriers the way we have seen in other nations. I want also to thank the Ministry of Agriculture, particularly the National Cereals and Produce Board, for their kind donations of foodstuffs. I want to thank those in the community, in the churches. We have continued to work with the religious community. As I mentioned, we had a meeting with them this morning, as you know. We have continued to work with them so that they can be able to assist us in not only educating the flock in matters spiritual and spiritual nourishment, but also to do with reaching as many people as possible to follow the rules that the Ministry of Health has made. Members of the Fourth Estate, we value your support. We do not take it for granted. Therefore, I appeal to you to continue doing the same. And I appeal to other well-wishers to come forward and offer support, not only to the government, to the churches, but also to individuals who continue to suffer at home. Asanteni sana. Niseme kidogo nichukue fursa hii kusema ya kwamba leo hii ndio tumetangaza idadi ya watu ambayo iko juu zaidi tangu tulipoanza kutangaza ni watu wangapi wameambukizwa na hii virusi. Na ningetaka kusema ya kwamba idadi hii tumewezeshwa kupima idadi hii kwa sababu watu wa Ministry of Health, watu wa Wizara ya Afya huko Isili na kwingineko, ndio tuweze kuchukua samples ya watu wengi, sana sana kule ambako tunajua kuna incidences ya hii virusi. Kwa hivyo ni vile tu kuendelea kusihi wananchi na kusihi kila mtu tujaribu sana kuona ya kwamba tunafuata zile sheria na masharti ambayo imetolewa na serikali, na ambayo tukiifuata tunaweza kuwa na bahati, tunaweza bahatisha. Ni matumaini yetu tutaendelea na hii idadi ya watu, lakini inategemea na vile tunaendelea kupata hii reagents ambazo tunatumia kwa hii kazi. Kwa hivyo jameni, tusaidiane, tusifanye sasa badala ya kwenda mazishi na kuzika mtu mmoja, wataendelea sasa kuzika watu wengine. Hata wenyewe hatujui kama watarudi ama hawatarudi. Tunaomba Mungu awasaidie, neema zake ziwe na hao watu, lakini jameni, it was unnecessary. Kwa hivyo wale ambao tuko hapa Nairobi, tafadhalini, tulisema iko sababu ambayo ilifanya serikali iseme watu wale wako Nairobi tukae Nairobi. Na ukiona vile sasa counties nyingi zinaendelea kuwa na watu ambao wameambukizwa, na sana sana watu hawa wanaambukizwa na watu ambao wametoka Nairobi, watu ambao wametoka na Mombasa, pali ambapo serikali imeamuru watu wasitoke huko na wengine wasiingie. Juzi nilimweleza vile watu wengine wanatoka Mombasa, wanapimwa, hawagojei wapate results, matokezo yake hawajui ni gani. Sasa wewe unaenda hujui kama ni positive ama ni negative. Wengine wanapata results wakiwa Makueni, ndio naambiwa sasa wewe rudi Mombasa kwa sababu umeambukizwa. Tafadhalini, mimi naomba wananchi, naomba kila mtu tusaidiane, kwa sababu tukisaidiana tutashinda. Tukiwa pamoja tutashinda. We can win, and we have no choice. We must win. I thank you.
The group between the age of 18 and 39, who, according to your statement on Tuesday, are the group that are responsible for the widespread.
Nancy Okware kutoka KBC. Hapo jana mlitangaza kwamba pale Eastleigh na vile Old Town mmeongeza ule muda wa kutotoka ama kuingia katika mitaa hiyo miwili. Na wengine wamekuwa wakiuliza, je, kama serikali katika kile kipindi cha kwanza ambapo mlikuwa mmefunga maeneo hayo, je, mnahisi kwamba mlifanya mambo ya kutosha ili kuhakikisha kwamba mnaangazia ile hali ilivyoko pale, kwa mfano kupima idadi ya watu ambao inatosha? Na vile hapo jana kulikuwa na ile shughuli ya kupima watu iliyofanyika kwa hapo Eastleigh. Na je, watu ambao mliwapima ni miongoni mwa idadi ambayo mmetangaza leo hii, ama mliopima pale walipatikana kwamba hawana virusi hivyo? Maanake leo hii hatujasikia yote kutoka pale.
My name is Chemutai going from Citizen TV. First, in the meeting with the religious leaders, there have been calls out there for sort of a review of that decision to close down churches and other religious institutions. Maybe have you relooked to have protocols for possible opening if anything like that has come on the table? And then the last one, Dr. Amoth had mentioned that when you had in April you had that modeling where you expected the number of cases in the country to go up. But then it's this month that we are seeing, this past week has seen higher figures every single day. Is it that this is the peak, or is it because of increased testing? What is it that is resulting in the higher cases this past week?
Asante, thank you very much indeed. Charity, the issue of persons between 18 and 39, just about everything that we are doing includes this group. And if you look at the measures that we have taken, the curfews, the closure of some of the socio interactive places, essentially what we are saying is that the less people get together, the less they come together, the better for everybody. Because if between 18 and 39, you'll find that you are healthy enough, you are strong enough, you can become positive, but you remain asymptomatic, and what will happen is that eventually you'll give it to somebody else, even though you yourself are okay, assuming there is no underlying issue, assuming you are not diabetic or HIV or those other conditions that we have. So these are the people I am appealing to stay in Nairobi, not to travel outside, to stay in Mombasa, not to travel outside. If you are in Isili, these are the people we are asking that you get involved in ensuring that people are distancing themselves. You'll also notice that those would also be the young parents. Therefore, you should not expose your baby. They have also got young parents. At 39, you have got a parent that you can very easily.
Sarma Enterprises Limited. We are your trusted and reliable supplier of quality timber products, construction material suppliers, which are river sand, ballast, building stones. Visit our website on www.sarma.co.ke. Sarma Enterprises Limited. Quality